Hello everyone. Today we are going to discuss a very interesting X-ray. It is of a boy who was about 18 to 20 years of age, and he presented in the emergency department during my duty with the complaints of swelling and severe pain after he tripped over and his face hit on the windowsill. I examined this patient and ordered this X-ray, which you see right here. What exactly do you see on this X-ray? If you look closer, you are going to notice that there is a fracture on the left mandible. Can you see this line? So there is a through and through fracture of the left mandible. But what exactly is this X-ray called? What are you going to write on your physician notes or your investigation order sheet? This X-ray is known as an orthopentomogram. It is not something that you are going to order as a routine investigation. So, what are the indications or what are the things that you are going to look for which help you decide if you have to order this X-ray? The Manchester Mandibular Fracture Decision Rule will help you decide whether you need to order this X-ray or not. So I have made it easy by arranging it in such a way that if you approach a patient, you can easily recall these steps as you examine the patient. When you first approach the patient, you are going to look at the patient's face. The first thing you should notice is whether there is a step deformity or not, which means that the right and the left side of the mandible are aligned, or one of them is higher or below the other one. So that is going to tell you if there is a step deformity. The second thing to look at is the patient's smile or how the lips are shaped. If there is a fracture of the mandible, the patient is not going to hold the smile within a single line. It is going to be in a slanting manner or a sardonic smile. The next 3 points are related to the command that you give the patient. You're going to ask the patient to open their mouth or show their teeth. And you have to notice 3 things. First, does the patient have any broken teeth? Second, do the patient's teeth meet abnormally or there is malocclusion, which means that they're just congested and they're stuck into one another after the fracture. And the last one is, does the patient report pain while their mouth is closed? So after you have examined the patient, when their mouth is open, you ask them to close their mouth, and then you see, does the patient have any pain when their mouth is closed? If it is a yes to any of the above questions, only then you are going to request this particular mandibular X-ray. Now the question is, what is the management or what to do next? The first thing you will do is call your maxillofacial surgeon, because the ultimate decision of the management of a fracture of the face has to be made by him. The thing that you have to do as an ER physician is to manage the ABCDE of the patient, which stands for airway, breathing, circulation, disability, and exposure. And in this case, airway is the most important component. So here it says, with bilateral mandibular body fractures, a flail segment, anterior tongue support is lost, resulting in posterior displacement of the tongue, which occludes the airway. This means that whenever there is fracture of the mandible, specifically on the both sides, a flail segment, which means that the mandible is just going to hang or swing, that is produced. This causes the tongue to fall back. Next, in this situation, the patient's airway must be protected by intubation as soon as possible. As a temporary measure, ask the patient to lean forward or place them in the recovery position. If this is not possible due to other injuries, the flail segment should be grasped and pulled anteriorly, pulling the tongue forward and an oropharyngeal airway inserted. Patients with an open mandibular fracture should be given a broad spectrum antibiotic whilst in the emergency department. So here they're just telling you about this maneuver when you pull the mandibular forward, just like we do it when a patient is in a collapse state, when we do the head tilt and chin lift. So, this is exactly what we are doing. We are creating space so the tongue does not fall back and occlude the airway. And this is all the management that you need to know about and do in the emergency department. I hope you understood what a orthopentomogram is, what do mandibular fractures look like, and what you need to do as an ER physician. I hope you understood this. Please let me know in the comment section below if you have any queries regarding this x-ray. Thank you.